With Parkinson's disease rates ranging up to 43 per 1 lakh of population, India is emerging as a leading hub for patients living with Parkinson's disease. April 11 being World Parkinson's Day, Meril believes that it is just not about awareness, rather it is about action, empathy and empowerment to those living with Parkinson's. Parkinson's may affect movement, but awareness leads us one step closer to the cure. Parkinson's is just not about tremor, it is a complex and diverse neurological condition which demands full attention and research. Behind every Parkinson's disease diagnosis is a strong story of strength. This month, we honor those stories and push for progress. To discuss all of this today with us, we have Dr. Rohit Gupta. Dr. Gupta is a leading and most renowned neurologist of the region, currently serving as a chairman to Neurosciences with Accord Superspeciality Hospital, Faridabad. Dr. Gupta specializes in treating a wide range of neurological conditions including Parkinson's, epilepsy, stroke and multiple sclerosis to name a few. Dr. Gupta is a leading stroke specialist of the region, having pioneered thrombolytic therapy for stroke treatment, and to date he has treated more than 1,000 stroke patients, making it the highest number in the region. Dr. Gupta has also introduced botulinum toxin injection therapy for conditions like chronic migraine, dystonia, spasm and facial spasm. So I welcome Dr. Gupta on behalf of entire Meril family to this candid conversation and thank him to spare out some time with us. So Dr. Gupta, to start with, what is Parkinson's disease and what are some most common signs and symptoms of Parkinson's?
So Parkinson's disease was first discovered by an English physician, Dr. James Parkinson, in the early 19th century as shaking palsy, which was later named as Parkinson. So Parkinson is a progressive neurodegenerative disease in which there is gradual loss of dopamine producing neurons. So dopamine is a neurotransmitter which is involved in movement, which is crucial for the movement. So loss of dopamine means loss of movement. So Parkinson's disease is an insidious onset, gradually progressive disease. It is usually occurs in males more than females. The age of onset is usually 60 years of age, but it can occur as early as less than 20 years of age if there is a family history. When we talk about the signs and symptoms, few points are very important. First, it is insidious onset, gradually progressive disease. Symptoms usually start on one side and it is progressive in nature, and symptoms may vary from person to person. To begin with, sometimes symptoms are so subtle that it may go unnoticed, like reduced arm swing while walking or decreased blink rate or expressionless face. But when the disease progresses, patient develop two types of symptoms, motor symptoms and non-motor symptoms.
So how do we differentiate between motor and non-motor symptoms to a layman person?
So the three cardinal symptoms in motor symptoms are tremors, bradykinesia and rigidity. So when you talk about tremors, so tremors are typically rest tremors, means they occur at rest. It is found in up to 80% of patients, and usually it starts with tremor in one hand or in jaw or one leg. Then bradykinesia means slowness of movement. So the patients become very slow. He does his activities of daily living in a very slow phase. Then comes the rigidity, which is typically known as cogwheel rigidity. So body becomes very stiff. Then the posture changes. The posture becomes very stooped and flexed posture. The gait becomes very slow. The handwriting changes. It becomes very small, which is called as micrographia. And with time, there can be effect on speech and swallowing also. Among the non-motor symptoms, mainly the patient has dysautonomia, means there is orthostatic hypotension. Means when the patient gets up, there is rapid fall in BP, which can lead to fainting attacks also. There can be GI symptoms like constipation or diarrhea. There can be erectile dysfunction in males. There can be sleep-related changes like decreased sleep or some sleep-related behavior disorders. Then there can be change in mood and change in cognition also, like dementia may also.
So what are the most common causes of PD and what is the etiology of Parkinson's?
So when we talk about the etiology, then the most cases have unknown etiology. Etiology is not known. So most cases are idiopathic. But in 5 to 10% cases, there are some genetic factors also, especially in those cases in which there is a family history. And some have secondary causes also, like vascular Parkinson. So the patients who get repeated stroke or small vessel disease, they develop secondary Parkinson, or there can be some drugs which causes Parkinson, which is called as drug-induced Parkinson, or there can be some toxins, chemicals, pesticides, or repeated head injury which can cause Parkinson.
So how common Parkinson's is? What is the Indian scenario of Parkinson's? How much burden Indian population does have of Parkinson's?
So Parkinson is very common. It is the second most common age-related neurodegenerative disorder. It is the most common neurodegenerative movement disorder. When you talk about Indian population, so India has got one of the highest absolute number of cases. 10% of the global burden is from India only. The prevalence in India is around 15 to 43 per 1 lakh population, and there is special community in India called Parsi community, in which prevalence is up to 328 per 1 lakh, which is highest in the world. And one interesting fact is the age of onset in Indians is around 1 decade earlier than rest of the world. Means Indians are getting Parkinson at a younger age group.
Get it. So it is comparatively more common in India rather than other population, and young age of onset is
more, 1 decade earlier.
Yeah, 1 decade earlier. So how PD is diagnosed? Like is it clinical? Is it pathological?
So PD, the diagnosis is primarily clinical. There is no single test which is confirmatory, but there are investigations which help in the clinical diagnosis like CT scan, MRI, PET scan, DET scan, and the genetic testing.
Okay. So is Parkinson's hereditary? I would like to simplify my question. Can I get Parkinson's if one of my parents has Parkinson's?
So if one of the parents has Parkinson, then definitely there is an increased risk of getting Parkinson. But most people doesn't get Parkinson even if their parents have Parkinson, because Parkinson is not guided by a single factor. It is guided by multiple factors, and it is due to a combination of genetic as well as environmental factors.
Get it. So should I go for a genetic testing if one of my parent has Parkinson's?
So this is very important. See, the genetic testing is not routinely recommended in all Parkinson patients. Even if you have genetic predisposition, then also there is no guarantee that you will get the Parkinson disease. But if you still have concerns, then you should consult a healthcare professional.
So what are some of the most common genes or genetic factors which are responsible for Parkinson's?
So the list is very long.
To name a few?
There are a lot of genes which are involved. Some common genes are like SNCA, PRKN, PINK1, GBA, LRRK2. So LRRK2 is the most common gene. The inheritance is usually autosomal dominant or autosomal recessive. But one thing is very important, that genetic testing, they identify these mutations, but the interpretation is very difficult, it is very complicated, and it requires the expertise of a healthcare professional.
So since it is a complex disorder and is of mixed etiology, then who should go for genetic testing? What kind of patients or what kind of patients' families go for genetic testing?
So as I told you earlier also, that PD testing, the genetic testing is not routinely recommended, but there are, yes, subset of patients in which should undergo this genetic testing. Like if you have early onset PD, means less than 50 years of age, if you have juvenile onset PD, less than 20 years of age, or you have a family history. Family history means if you have your first or second degree relative with Parkinson disease, then you may undergo this genetic testing as a preventive genetic testing to know your risk.
So since genetic testing is not routinely recommended in all Parkinson's patients, what will be the right and most appropriate genetic testing for a PD patient you would recommend?
So telling you the background, there are 4 types of tests which are available in the market. One is single gene testing, then there is panel testing, then there is whole exome sequencing and whole genome sequencing. So each test has its advantages and disadvantages. So starting with the single gene testing, as the name suggests, it focuses on targeted genes. But the disadvantage is it doesn't identify your new mutation or the uncommon mutation. Now in panel testing, you identify multiple genes simultaneously, but it again is not able to find out your new mutation or the uncommon mutation. The most promising is whole exome sequencing, in which you analyze the coding regions of all genes. So it identifies your new mutation also and uncommon mutation also. Okay. But the disadvantage is the uncertainty of interpretation. In whole genome sequencing, you analyze the whole genome. So it has the same advantage.
The entire DNA.
But it is very costly. So if you talk to me, the most practical one is the whole exome sequencing. But if it comes out to be negative, then you should go for whole genome sequencing with new clinical features, family history and reverse phenotype.
Get it. So, according to you, whole exome is the most appropriate
Yes,
test for
yes.
just
It is most
reiterating.
cost effective and gives you appropriate information.
So, is it cost effective even than single gene or multi gene panel testing?
Yes, it is most cost effective among all four.
Get it. So what is the treatment for Parkinson's? Once we have the clinical identification, we have the pathological identification as well, we know the diagnosis now. So what would be the course of treatment for a PD patient?
So treatment is very important. Few things to be remembered are that it is a treatable disease,
Okay.
but it is not curable. So most patient respond, but response rate may vary from individual to individual, and it is a lifelong treatment. The treatment is basically on the symptoms and to improve the quality of life. So when we talk about the treatment of Parkinson, there are three types of treatment. One is medical treatment, then comes the surgical treatment, and some therapies are there. So in medical treatment, the dopamine is the cornerstone of treatment. Then there are dopamine agonists also, which act like dopamine. Then there are some COMT inhibitors, MAO inhibitors, and anticholinergic drugs. When you talk about the surgical treatment, the best as of today is DBS, deep brain stimulation, in which you implant a device inside the brain. It is usually done for advanced Parkinson disease who have lost the response to dopamine and they have developed side effects of dopamine like on-off effect or dyskinesias. When you talk about the therapies, so as you know, there is difficulty in walking, so there is a physical therapy, physiotherapy, then there is speech therapy, and there is occupational therapy. Some experimental therapies are also going on, like gene therapy and stem cell therapy.
So once, for example, a patient has been identified or diagnosed with PD and it comes out to be genetic in nature, family has been tested already. So is there any preventive or prophylactic therapy available for Parkinson's which can slow down the onset of disease in that family, in the at-risk family members, to be more precise?
Yes, as I told you, you should go for preventive genetic testing if your first or second degree relative have Parkinson's disease.
Get it. So let us talk about a PD generation.
Now the PD generation is the first global PD study which gives you the free genetic testing as well as counseling for all diagnosed PD patients.
So that will help. I think that will help in building the database, genetic database for the PD population.
Definitely.
That is a great initiative.
And patient can go online on the PD generation portal.
And that is how they can enroll.
They can enroll.
Okay, get it. So it is a global clinic.
It is a global survey.
Yeah, okay. So this was a great and indeed candid conversation. We learned a lot of things from your perspective about Parkinson's. So we would like to have your concluding remarks. How you would conclude the entire conversation?
So conclusion is the most important thing is PD is a treatable disease. It is not only genetic, it is a combination of genetic and environmental factors. Treatment is there, it is a lifelong treatment, and genetic testing should not be done in all PD patients. It should be done wisely, especially if PD is young onset and if there is family history.
Get it. Thank you so much, Dr. Gupta.
Thank
it
you.
was indeed a learning conversation with you, and we would like to keep connecting with you on future opportunities also. Thank you so much
My
on behalf
pleasure.
of the entire family, Meril family.
Thank you.